Hi, my name is Dr. Shatul Pariks, and I'm the director of the Northwest Parathyroid Center. We specialize in parathyroid disease only. Primary hyperparathyroidism is a condition that involves one or more of the parathyroid glands that grow to be too big and produce too much parathyroid hormone. Parathyroid hormone is a very sensitive regulator of calcium metabolism in the body. When one or more of those parathyroid glands grows to be too large, it produces too much of this parathyroid hormone, and it causes calcium to be removed from the bones and placed into the bloodstream. This can predispose you to having osteoporosis or very brittle bones, kidney stones, severe abdominal pains, depression. The good thing about parathyroid disease, primary hyperparathyroidism, is it's extremely curable if diagnosed and treated appropriately. Patients come in to see us with a diagnosis of primary hyperthyroidism, and our goal is to first and foremost identify which one of the 4 parathyroid glands is the bad actor. We've revolutionized the ability to use ultrasound, high-resolution ultrasound, here in the clinic to identify a patient with primary hyperthyroidism. Over the past several years, I've developed a technique to manage parathyroid disease surgically that involves a small outpatient procedure that takes anywhere between 6 and 15 minutes that has revolutionized the surgical management of parathyroid disease. We see patients from all over the country and many international patients with this disease state. We see these patients, and on their first visit we perform an ultrasound here in the clinic, and 95% of the time we can identify which parathyroid gland is the bad actor. In the office, we're able to identify this patient's parathyroid adenoma, and you can see here this is the right side of the neck. This is the thyroid gland, and what we've identified is a right inferior parathyroid adenoma, and this was found in the office. No other imaging study was done, and now we'll re-identify this here in the operating room prior to surgery to confirm location. Once we identify the bad parathyroid gland, we schedule the patient for surgery. The patient is taken to our ambulatory surgery center, where either via a local anesthetic technique or a general anesthetic technique, the patient undergoes anesthesia. The surgery, like I said, takes between 6 and 12 minutes to perform. Our results show a greater than 99.9% cure rate with a 0% complication rate. There are many reported complications, including vocal cord paralysis, infection, need for reoperation. We have yet in our center to have one of those complications, and we don't anticipate. We'll remove all the instruments, and now a quick closure involving approximately 3 sutures that will absorb within the skin, and then the skin itself is closed with glue. Our patients all go home the same day. With minimal pain, most people just take a Tylenol for pain, and they are up and doing their normal, resume to their normal activities within 24 to 48 hours. Now we've changed the management of parathyroid disease from a surgery that takes anywhere between 2 and 4 hours to a surgery that takes between 6 and 12 minutes. And that's the end of the case. So at most centers, it's a 4-hour procedure. We pared down to a 15-minute surgery.